I'm at Blue Cross talking to Bruce Harris. Now, Bruce, you are in charge of the pharmacy division of Blue Cross Blue Shield here in Alabama. Did I get that right?
Close. I work in the pharmacy division. My official title is Medicare Clinical Pharmacy Manager.
Okay.
But there is a host of myself and others like me, other associates, pharmacy-related associates, who are helping to manage the drug prescription benefit of the Blue Cross Blue Shield products.
Okay, this is a great thing. I'm so glad I got to talk to you because that's Part D?
Part D, yes, sir. So we think of Part D as in the Medicare products.
Right.
Part D being the drug prescription. But in pharmacy here at Blue Cross, we not only obviously service our Medicare members, we also service a host of commercial members as well. So anyone that's not on Medicare but is on Blue Cross, we certainly provide those prescription benefits as well.
Right. So, and there are, okay, so, and there are tiers.
There are tiers, that's correct.
Okay, so let's talk about the program, not in detail so much, but there are 1 through 4 or 1 through 6?
There are 6. That's great that you know that. That's right. For many of our Medicare products, our formularies, so the medications that are covered under our prescription benefit, we do tier them. Co-pays are different on each tier for medications, and we put all that together. That's called our formulary development, the list of medications that are covered by our product, and we certainly are responsible for that. Also, what we call utilization management, making sure that the proper, really the proper regulations around medication use are in place. We don't want people taking too much of a medication or too little of a medication, and making sure that those programs are in place.
So I'm glad you said that, because that brings me to my next question, which is if someone's taking medication A and B and C and D, or someone's just taking, some people take just a couple of medications like myself, maybe 3 or 4.
Sure.
Some people take 10 or 12. How do we know that one medication isn't messing up the other medication, or if you add one more medication to that and you know you get a rash? I mean, what's going on in that area now?
Well, for the most part, the physician who prescribes that, the pharmacist who fills that prescription, because of their clinical knowledge, we are trained to know drug-to-drug interactions. That's sort of the basic element of pharmacy, and certainly a major part of what our providers are doing when they're prescribing medications. For our members, they need to trust their healthcare providers, their doctor and their pharmacist, to know that those things are being taken care of. On a very genetic level, there are some real advances being made now where we know exactly how much of a drug that you're consuming is really having an effect. So whether you take 100 milligrams or 50 milligrams, based upon the genetic makeup of your body, you may only be receiving 10% of the benefit of that.
Oh my God.
And so there are genetic tests that are available, and they're becoming more and more popular in healthcare.
What happens when someone uses more than one pharmacy? They may use a big box pharmacy, they may use the local pharmacy for one thing because it's closer to their home, or they may use the pharmacy coming out of the hospital if they've had something done at the hospital. The hospitals that have their own pharmacies. How does that react? Because that isn't one pharmacy, that's 2 or 3 pharmacies that are prescribing something. Do they know about the other drugs as well?
Not always. Typically, if let's say that a member uses one of the chain stores, typically chain store 1, 2, 3, for instance, will use the same dispensing software system as the next store. So we'll call it store 2, 3, 4. And that they're sharing a common database,
right.
And so that prescription data is available to every pharmacist that's completing those prescriptions.
Right.
However, if a member goes from one chain to the other, for instance, it's obvious they don't share the same dispensing software, and it makes medication management very challenging, both for the member and for the healthcare professionals who are helping those members manage those medications.
So what's the answer?
we would hope that our members, those that have a Blue Cross Blue Shield card in their pocket, would have a chosen pharmacy, and that would allow that one particular pharmacy to fill all of their prescriptions. We understand there are circumstances where maybe that isn't possible. We have some technology here at Blue Cross that allows us to collect all of that data. So we're the keeper of those prescription claims. We have programs launched right now looking at prescription drug utilization across multiple pharmacies.
Sure.
So I would encourage members that if you're, whether or not you're using multiple pharmacies, if you receive a call from Blue Cross and Blue Shield and we're calling to offer comprehensive medication management services, we're calling on behalf of your health. We would appreciate if you would participate in those and let us just review those prescriptions that you're on.
And what is the relationship between Blue Cross and the pharmacists? This is an important thing, that the Blue Cross and the pharmacists have a relationship.
It is, absolutely. At Blue Cross, we recognize that pharmacists are the most easily accessible and most frequently accessed healthcare professionals on the healthcare team.
Right.
And for many of our members in rural places in Alabama, the pharmacy is the primary healthcare destination. Right. And recognizing that, we know that we need to have an established relationship with those providers and to ensure that they have the tools and the resources necessary to meet our members' needs.
Right. And there's something else I just learned about, something called Blue Days. At the pharmacy. Now, what is that about?
We've been hosting Pharmacy Blue Days at pharmacies across Alabama. If you can think of it as a Blue Cross Blue Shield sponsored health fair at your local pharmacy, you're on the right track. So we invite members in the community to come to a pharmacy. We have Blue Cross Blue Shield associates there providing lots of clinical services, offering flu shots, offering diabetic eye exams, for instance, offering medication therapy management, consultations, so talking to their members about their medication regimens, enrolling them in medication synchronization, the idea of a person who's on multiple medications, getting those medications where they're filled on the same day of every month. Seems pretty intuitive, but you know, it doesn't happen nearly as often as we think that it should, and it's tremendously helpful and really alleviating some of the confusion for some of these complicated medication regimens.
I want to go back, something I was just thinking about as you were speaking, about generic drugs plus non-generic drugs.
Sure.
So we've got, how is that working out these days? I know it's been around for a long time.
It has been around for a long time, absolutely. A particular medication comes to market as a brand, and the federal government says that there's a patent on that for a number of years, and when it comes off of patent, the active ingredient in that medication, which makes it useful for whatever it's designed to treat, is then able to come off patent, and it can be a generic. And those generics go through very rigorous testing. They have to have the same clinical outcomes as the branded product.
Right. But for a reduced price.
For a reduced price, absolutely.
Bruce, thank you so much for being with us. This is great information. Blue Cross is always looking for ways to make you healthy, keep you healthy.